Good evening, and thank you all for coming in on short notice. As you're aware, the Chief Medical Officer of Health held a news conference earlier this afternoon, and we are thoughtfully responding to the direction that she has provided to the province and to partners, including organizations like the city. So I have called an emergency council meeting for tomorrow at 9:30 a.m. and our executive leadership team, led by Adam here, is deeply committed and careful, and they've been swift in their decision making and in keeping with the provincial protocols that continue to escalate. So I have full confidence in city administration and that our task force on COVID-19 will continue to monitor the outbreak and advise council on additional necessary steps that the city should take as the situation develops. And council will have a chance to be updated fully on this tomorrow in public for their information. As your local government, we do have plans in place that will ensure essential services that you depend on, like drinking water, emergency services, transit, waste management, will all continue to be delivered regardless of what happens. But we do need to take action, and though there is no need to panic at this time, we need to act with caution because this is a serious health issue, and each of us can do our part to help limit the spread. So we are very fortunate to live in a city like Edmonton with access to some of the best health care in the world and where our emergency response is world class. And we also are the kind of community that will look after each other, get groceries for each other if we need to, keep each other safe where we need to, and band together. But know that your city is with you in that. And to that end, I'd like to ask Interim City Manager Adam Laughlin to provide you an update on today's decisions, and we will commit to frequent updates to the public as information is available. Adam?
Well, thank you, Mayor Iveson. As you know, this is a very fluid situation, and the City of Edmonton is committed to responding appropriately to the advice and direction provided by healthcare professionals. As the Mayor mentioned, further decisions may come out of a council meeting tomorrow. However, I want to share with you the decisions that administration has made today. We are proceeding with the cancelling of all mass gatherings as directed by the Chief Medical Officer of Health. Public engagement meetings of any size are postponed. For employees, all business travel, both within and out of the country, is suspended. All staff are asked to self-isolate for 14 days if they have traveled out of the country. This is a directive from the Chief Medical Officer of Health. We are also working to finalize our social distancing procedures within the city. This includes in-person meetings, training sessions, and other ways we convene. Our recreation centers will be ceasing any programming that involves large numbers of attendees, and in the next 24 to 48 hours, we will determine whether recreation centers will be closed. Any patron that is sick, we ask you to stay home. We will be working with our senior serving centers, Central Lyons, Northgate, and Mill Woods, to close operations in the next 24 hours. And there are other centers that we partner with, and we will work with them as well. We are increasing frequency and intensity of cleaning in our facilities and on our transit systems. And we are working with our partners at the Edmonton Public Library to ensure consistency in our decision-making and practices. These are trying times for all of us. What's top of mind for me is our staff, who work hard to keep the services in Edmonton running. Keeping them safe is my priority. We also have mental health supports in place for those who are experiencing challenges as a result of the situation. We are committed to providing them and you with the information we all need to keep safe in this evolving situation. Edmontonians should know that their safety is our #1 priority. Thank you all for coming on short notice, and we're pleased to answer any questions you may have.
On the rec centers, we heard from Dr. Hinshaw today about schools and why they wave back, and they're still going back and forth on that because If the kids don't go to school, they're gonna go somewhere else. Is there something you're weighing back and forth on the rec center?
We are. Part of the first step is to ensure that the large public activities or large groups of activities that we're putting those to, or we're ceasing those. But we're also considering the potential of closing the facilities in total. And we're developing plans to prepare for that on a moment's notice.
Is there a downside to closing the facilities?
I think what we're trying to weigh is in these times where what we're asking folks to do from a perspective of human interaction, it may be challenging for folks to carry on through their day. So we're trying to balance keeping activation up, but also conscious of the public health risk associated with that.
What is the plan to continue these essential services if resources start to grow thin?
So one of the other things that we're doing for our employees is as part of the social distancing guideline is work from home. And so for some of these core services that do have the ability to work from home, we're strategizing the best way to use that to be able to balance the services that can be provided at the city or at home. The other side of that is just the intensity that we have in terms of cleaning and hygiene to make sure that we're minimizing the risk of transfer.
How does this, I guess, how will this affect festival season? Is it too early to say at this point? Is that what's going to be talked about tomorrow?
So on the advice from Alberta Health Services, all public gatherings are going to be canceled. So there's an immediate impact if there is one in short order here. But what we're going to be doing is assessing the risk, certainly taking the lead from Alberta Health Services in terms of their updates, which they've been very helpful with that, to determine the next steps for those festivals in the future. If it were now, they would be canceled.
How far out is the time horizon that you're aware of from Alberta Health?
Don't have a definitive date on that, Scott, in terms of the timeline out. But we do have regular communication with Alberta Health Services to be able to inform any steps that we need to take to prepare for that.
You
In terms
nervous
of the
about
use-
ITU?
I wouldn't say we're nervous. I think we're prepared, and we're making sure that we take the necessary steps to prepare for that.
In terms of the social distancing, what thought has been given to maybe not having packed LRT trains and buses? What about transit and limiting the number of passengers on transit? Has that been discussed?
We're discussing all forms of how we manage in this time. Transit is an essential service in terms of getting people to and from destinations. So our response to that immediately is to increase the intensity of the cleaning and the frequency of the cleaning to be able to minimize as much as possible, but we'll continue to evaluate. And as you've seen with the announcement from Alberta Health Services, this is an ever-changing situation that we need to respond to in kind.
Is there a back and forth on that? I mean, if people are crammed onto the train, if you want to limit numbers, then they'll just be crowded on the platform. What do you do?
Again, iterative situation where we need to be able to respond based on the circumstances that are happening as a result of the changes that we're implementing here, and working closely with Alberta Health Services on the impact associated with that.
Any update on plans to work with shelters in the city?
It's another thing that we've captured it's on ELT's radar in terms of how we support our external agencies. And I believe Dr. Hinshaw provided an update yesterday that the risk planning associated with the vulnerable populations is something that they're paying attention to as well.
How many city rec centers are there? You know, and beyond rec centers, how many sort of city facilities will this impact?
Don't have that number. I think as we continue to get more information on the steps that we're going to take, it's information that we can provide.
Does that include the Zoom?
Don't know at this point in time, but certainly something that we've got on our radar.
What do you need to figure out between now and tomorrow morning to make anything out of this?
Actually, I'll let the mayor speak in a moment. That's
Sure.
okay. What we're doing tonight is just identifying the key information that we need to share with our council. And that is the steps we're taking with our employees, some recommendations to council in terms of how we go forward, and the plans that we have in place. There may be a necessity to activate the Emergency Management Agency, which is an agency of council, if the situation's warranted. And so we'll go through discussions like that with council, and the mayor might want to add to that.
Yeah, when the Emergency Advisory Committee met earlier this week, we did discuss the scenarios under which that committee would have to be brought back together. We're having it's an emergency council meeting, but not the committee that meets with the Emergency Management Agency. That's an escalated step. We're not at this point yet. So it's a regular council meeting called on an emergency basis. Purpose of the meeting is first and foremost to get this information that's been shared today and anything else that develops overnight in the hands of the governors and the public, and then also for council to discuss continuity of our work, which our recommendation will be to suspend council meetings and committee meetings indefinitely while we focus management's resources and our time on response to the emerging coronavirus situation and all of the attendant economic and other challenges that are on all of our minds. And so normal business of council will be suspended. That will be the recommendation at council tomorrow. This will allow city staff to spend all of their time focused on working through some of the kinds of questions that you've asked here today and making critical decisions in response to the advice of the Chief Medical Officer of Health about what the city and all public agencies should be doing to respond to the changing situation.
So urban planning, community services, executive.
Yeah, there was a committee meeting tomorrow afternoon just to do interviews and appointments. That will be canceled. Next week's committee meetings will be canceled. And as to when and how we would resume the normal business of council, that's one of the things that we'll begin to discuss. But we'll also need to put some measures in place for us to be able to meet virtually or by remote if necessary in order to continue to oversee the work of administration and help make sure that the public is informed of whatever's happening, particularly any critical decisions that would come before council. But at this point, the scale of severity that we're at is all within the delegated authority of the city manager and the executive leadership team to make decisions in the public interest. As that escalates, council gets involved, and then ultimately, not to get ahead of ourselves, but if it becomes a state of local emergency, council meets in its advisory capacity to authorize the agency to stand up, but we're not there yet. We're not even close to that yet.
I heard earlier in the week there are sort of 4 levels of different levels of response for the city. Where are we right now? Can you tell us more about those levels?
Well, and this is from the province, within a pandemic plan, phase 1 is awareness, which is happening. Phase 2 is containment, and that's underway with the instructions from Alberta Health Services around self-isolation and containment. If containment, and this is from Alberta Health Services and their pandemic plan, if containment becomes a challenge, then it's into mitigation. And I mentioned when we met that could be larger closures or larger restrictions on gathering. And so those are the steps that we would work through. I apologize, I'm not remembering the 4th one. Recovery. Thank you, Mr. Mayor. Recovery. So that would be the step when it's in through mitigation and a greater degree of containment, then we're into a recovery phase. And again, we would follow the lead of Alberta Health Services on that.
So am I reading it right that we're on sort of phase 3?
Phase 2.
We're on phase 2?
Phase 2.
We're seeing closures and stuff, right?
That's
It's-
the continued containment.
Continue to continue containment. If you start to see, again, from Alberta Health Services and Dr. Hinshaw yesterday, school closures of those, that's where we're getting into a larger component of that pandemic plan, and that would be phase 3.
This is all the neat stuff in theory on paper. Have you practiced this in a setting and are you recognizing and doing things that you practiced?
I would say we are. With each branch within the City of Edmonton, we develop business continuity plans to respond to emergency situations or urgent situations. We have been testing those leading up to this. We continue to test those. We've also established, as the mayor said, an emergency agency team, which is the executive leadership team, my apologies, police and fire. And we have also established the Emergency Advisory Council Committee, which is council. And so through tests, through exercises, we have, I believe from administration's perspective, prepared ourselves for this to the best of our ability. And through our conversations with council in their capacity as the advisory committee, we feel like we're in a good place, but it doesn't mean we're perfect, and it's something that we have to continue to work at. And as I mentioned earlier, this is ever evolving, and so you will receive a lot of updates in terms of that evolution.
You got an all-nighter ahead of you?
I suspect we'll have a late night tonight, and I suspect we'll have a busy weekend as well.
Can you confirm the isolation process for city staff? Again, if they were traveling in the last 14 days outside the country, can you self-isolate for 14 days?
That's on the advice from Alberta Health Services, and we would translate that to our employees.
What about
For,
council?
for our employees, we've restricted all business travel in Canada and outside of Canada.
What about councillors?
Well, and as far as councillors, I would assume that they would follow the advice from Alberta Health Services as well.
There were two on the phone yesterday in the afternoon portion, so are they out of commission now? Or?
One is Councillor Katarina's out of the country, and Councillor Hamilton was called away. So,
Mr. Mayor, we've seen things. We just talked to the police chief about people making 911 calls about obviously concerns with health issues. Some of the panic. How do you address that, and what would your message be to the people of our city?
well, we have a lot of high-functioning public institutions here, from police to the public health agencies to, I believe, the City of Edmonton, and we're here to maintain order and provide clarity in a situation like this, and maintain order as well. And the best way we can all contribute to that is by remaining calm and remaining neighborly and recognizing that a lot of people are in distress. A lot of people are very concerned. It's a time of high anxiety. There's a lot of economic anxiety on top of the public health anxiety. And so I think recognizing and acknowledging that, but also saying we are going to get through this together with the help of our first responders, with the help of our medical and scientific experts, and with the best efforts of everybody in leadership working together. And so that level of coordination between the city and the province and our other partners is very, very strong, and only getting stronger as this evolves and our focus shifts to it. So the situation is well in hand.
I asked Adam, I'll ask you now. The things you practice, are they ringing true?
Well, a lot of our exercises on emergency preparedness have focused more on other themes, including natural disaster, terrorism, and that sort of thing. And so we haven't practiced for pandemic, but if you practice for anything, it's going to sharpen your skills should the need arise. And so I think the constant focus on exercise over the last couple of years has helped prepare us and hone a lot of the skills necessary, and tested some of the systems that we may need in terms of interagency communication and collaboration, and also just everybody's willingness to put aside their day-to-day and focus on the matter at hand, which is certainly from my close contact with Adam here, what he and his team are doing and what council is going to be doing for starting tomorrow morning.
And your emergency center, because you wanted it bigger in previous budgets, didn't get it. Is it big enough?
Yes.
Yeah, it's adequate to the task.
And it's
Hmm?
and it's collaboration, POC. So the Provincial Operations Center, so there's a strong connection there, but the Emergency Operations Center is adequate.
And it is active now, it wasn't on Tuesday.
It is not activated yet. Something that we'll be confirming over the next few days here. Okay, thank you very much.
I should say Councillor Hamilton was not feeling well and chose, on the advice, to not stay at the meeting and to call in instead from remote. Thanks.
Chip for that'll start editing. Do you have an iPhone adapter on you? Yeah.